Preface my remarks.
Sure.
I'm one of
course.
the many freshmen here
Yes.
and have not seen everything how things work here. But as a freshman, we came in with fresh ideas. We didn't know what one faction might have and what another party of people wanted. We just came in very open-minded and went through the process, and we called people on our own to come and give us advice. We did research on our own. We had some of other freshmen who sat down and went on the line and did a lot of elaborate study to try and give us as much information as we could. Then we got together and we found out most of us agreed that the state-based health exchange is the best choice. Now, we don't have good choices. All we have is the federal and the state. And the state is by far better than the federal. The state exchange does not allow the federal government to come in. The federal government's already here. The bill has been passed, it's the law of the land, and the state exchange does not nullify the federal law. It is unfortunate we weren't talking about the more serious problem, is that we have a health care crisis in America, and the Obamacare, for lack of a better term, is it really going to solve and help bring these costs and these problems that so many millions of Americans have and resolve it? We have 30 million people that have no health insurance. Do they get health coverage? Of course. They go to the hospital ER room and get taken care of. But that's exorbitantly expensive. What is it, $300, $400, $500 just to run to an ER room when a person has a nosebleed or has a head cold? We need to come out with some kind of program where those uninsured Americans, and they have a chance of getting preventive health care coverage before they fall off the edge of the cliff. And that's the real issue we should be talking about. Unfortunately, all we're talking about is the state versus the federal, and the state is a better program than the federal.